Wow.
Hello and welcome back to my story Living with Lupus. I'm Susan Hendricks, and in today's episode, we're diving into an important and somewhat lesser-known topic. Does having lupus increase your risk of developing bladder cancer? Before we get started, this video is for informational purposes only. It is not intended to replace medical advice, diagnosis, or treatment. Always consult your physician or healthcare provider with any questions or concerns you may have. Let's begin by understanding what lupus and bladder cancer are. Lupus, or Systemic Lupus Erythematosus, SLE, is a chronic autoimmune disease where the immune system attacks healthy tissue, causing inflammation and damage to various parts of the body including skin, joints, kidneys, and more. Bladder cancer, on the other hand, occurs when malignant cells form in the tissues of the bladder. It's most commonly transitional cell carcinoma, and risk factors often include smoking, certain chemical exposures, chronic bladder infections, and in rare cases, autoimmune disease-related factors. Now you may be wondering, is there a direct link between lupus and bladder cancer? Well, let's look at the science. According to a 2021 review published in Autoimmunity Reviews, people with lupus have a slightly increased risk of certain cancers, including bladder cancer, compared to the general population. This is due to several factors. First, chronic inflammation. Lupus causes long-term inflammation, which may contribute to cellular changes over time. Chronic inflammation is a known factor in cancer development. Second, immunosuppressive medications. Some medications used to treat lupus, such as cyclophosphamide, have been associated with an increased risk of bladder cancer. Cyclophosphamide is known to irritate the lining of the bladder, which can lead to hemorrhagic cystitis and, over long periods, increase cancer risk. A landmark study in the New England Journal of Medicine found that high cumulative doses of cyclophosphamide were correlated with bladder cancer risk in lupus patients. And third, immunosuppression overall. A suppressed immune system may be less effective at detecting and eliminating abnormal cells, which can allow cancers to develop. Not all lupus patients are at equal risk. Risk factors include long-term use of cyclophosphamide, being over 60, and interestingly, male gender. Even though lupus is more common in women, bladder cancer is more common in men. Smoking, which independently increases bladder cancer risk, and chronic urinary tract infections or interstitial cystitis also play a role. If you're living with lupus and are concerned, be aware of these common symptoms of bladder cancer. Hematuria, which is blood in the urine, is the most common symptom. Other symptoms include frequent urination, pain, or a burning sensation while urinating, pelvic or lower back pain, and feeling the need to urinate without being able to. These symptoms can overlap with those caused by lupus flares or urinary tract infections, which makes early detection more difficult and more important. If you experience these symptoms, your doctor may recommend urinalysis and urine cytology to detect blood and cancerous cells in the urine. Cystoscopy, where a small camera is inserted into the bladder to visually inspect for tumors. Imaging tests like CT urograms or MRI to check for masses or spread of disease. A biopsy, where a small sample of bladder tissue may be taken during cystoscopy and examined under a microscope. And if you are on cyclophosphamide, ask your doctor whether routine urinary screening is appropriate. Treatment depends on the stage and type of bladder cancer. For early-stage, non-invasive cases, transurethral resection or TURBT involves the removal of the tumor via cystoscopy. Intravesical therapy involves placing chemotherapy or immunotherapy drugs directly into the bladder. For invasive or advanced cases, surgery may involve partial or complete bladder removal, known as cystectomy. Systemic chemotherapy, immunotherapy, and radiation therapy are also options. If you're a lupus patient, treatment plans may need to be modified based on your immune status and current medications. You can take action to reduce your risk. Avoid smoking. Stay hydrated to flush toxins. Ask your doctor about safer lupus medications if you've been on cyclophosphamide long-term. Get regular screenings if you are at risk, and report any urinary symptoms promptly. Lupus is a complex disease, and while the increased risk of bladder cancer is relatively low, it's important to stay informed, stay vigilant, and maintain open communication with your healthcare team. Remember, knowledge is power, especially when it comes to chronic illness. This content is for informational purposes only and should not be considered medical advice. Please consult your physician for any health concerns or before making changes to your treatment plan. Thanks so much for watching. If you found this video helpful, please give it a thumbs up, subscribe, and share it with someone who might benefit from this information. And remember, you are not alone on this journey. Until next time, stay strong, stay informed, and take care of yourself. Don't forget to hit the bell for notifications.